Omega-3 fatty acids, such as Epa-Dha 720, are believed to lower the risk of heart disease. They are often used with diet and exercise to decrease levels of a certain blood fat called triglyceride, and to increase levels of good cholesterol, HDL. Some supplement products may contain harmful impurities or additives, so it's important to check with your pharmacist about the specific brand you are using. It's also important to note that the U.S. Food and Drug Administration has not reviewed this product for safety or effectiveness. It's best to consult with your doctor or pharmacist for more details. As for the daily dosage, it's recommended to take Epa-Dha 720 as directed by your healthcare professional. And it's best to take it with food to avoid any potential stomach upset. The optimal timing for taking Epa-Dha 720 can vary, but generally, it's best to take it at the same time each day to help you remember. When taking Epa-Dha 720, it's important to follow the directions on the package label. If you have any questions, consult your doctor or pharmacist for guidance. Depending on the form of the medication, whether it's in capsules, chewable form, or liquid, the method of consumption may vary. For enteric-coated capsules, swallow them whole. If using the chewable form, be sure to chew thoroughly before swallowing. When using the liquid form, use a special measuring device to carefully measure the dose. It's important not to use a household spoon as it may not provide the correct dose. Some brands of this medication may need to be shaken well before use. If your condition persists or worsens, or if you suspect a serious medical issue, seek medical attention immediately. Some common side effects of Epa-Dha 720 include a fishy aftertaste, if your product is made from fish oil, nausea, bloating, or burping. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has directed you to use this product, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including easy bleeding/bruising. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you experience any side effects, it's always good to consult your doctor. In the U.S., you can report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. If you have any allergies to omega-3 fatty acids or fish, it's important to let your doctor or pharmacist know before taking Epa-Dha 720. This product may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss it with your pharmacist for more details. For pregnant women, it's important to use this medication only when necessary and under the guidance of a doctor. Make sure to talk to your doctor about the risks and benefits. If you are breastfeeding, it's not known whether this product passes into breast milk, so it's best to consult with your doctor before using Epa-Dha 720. As always, it's important to follow the advice of your healthcare provider. It's important to be aware of potential drug interactions with Epa-Dha 720, as they can affect how your medications work and increase your risk for serious side effects. It's best to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you suspect an overdose or experience severe symptoms such as passing out or difficulty breathing, seek immediate medical attention by calling 911 or contacting a poison control center. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. During your treatment with Epa-Dha 720, your doctor may conduct lab or medical tests to monitor your cholesterol levels and liver function. It is important to attend all scheduled medical and lab appointments. If you have any concerns or questions, consult your doctor for more information. If you forget to take Epa-Dha 720 on your regular schedule, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. It's important to protect Epa-Dha 720 from light and moisture, so avoid storing it in the bathroom and do not freeze it. Keep it away from children and pets. When it comes to disposing of Epa-Dha 720, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.